And we've moved on now to the Langenbeck-Virchow House, the venue of the World Health Summit, where we're joined by Professor Detlev Ganten, the founding president of this international meeting. Professor Ganten, thank you so much for joining us here today. Now, in our report, we just saw an innovative computer-assisted surgery system. High-tech medicine is all well and good if you can afford it, but who can?
Well, even we can't afford it for everybody. We know that the health system becomes too expensive. There are reforms all the time. Cost plays an important role. And certainly we cannot export it to the rest of the world. We cannot treat 7 billion people in the world with this type of high-tech medicine. We have to think medicine anew.
Now, speaking of costs, there is an increasing gap between the amount of money spent on medical care in the poor developing countries and in the rich Western countries. If we can just look at the numbers here, in one of the poorest countries in the world, just €7 are spent on medical care per person per year. In the U.S., that figure amounts to €5,500 per person annually. In other words, some people can't even afford antibiotics, whereas others have the benefit of high-tech robotics. How can we close that gap? What do we need to do?
That is an intolerable situation. This cannot continue. And we have to think about more justice with respect to health care around the world. Since we cannot export high-tech medicine and cannot pay for it, we'll have to think about something else. And this is prevention. And the most important point for prevention is education of the people so that they care for themselves. Self-responsibility, taking care of your own health. But of course, we have to give them the opportunity to do that. And that's what we are discussing at the World Health Summit.
And what do you think could be done to make medical care more equitable for everyone? Pharmaceuticals companies are often blamed for driving the prices up. What needs to be done?
Well, I think many pharmaceutical industries go to these countries, produce important essential drugs locally, less expensive, so that they are affordable. Of course, we need both. We need the so-called classical school medicine drugs need to be distributed at a reasonable price. At the same time, take preventive measures and make sure that we don't export industrialized nutrition, which is expensive and unhealthy.
Now, malaria and AIDS are the diseases that make the most headlines in the developing world, but diabetes is also on the rise.
That's exactly because we are exporting our civilization and nutrition, industrialized food into these countries, and less mobility, cars, and so on. And so, the lifestyle, which is unhealthy, as we know, in our modern societies, is being exported, and that needs to be reversed, actually.
All right, Professor Ganten, we'll be back with you in just a moment. But first, let's introduce you to Timo and Tamara. The brother and sister team are taking part in a study aimed at preventing type 1 diabetes from developing in children with a high genetic risk.
These siblings appear perfectly healthy. But a year ago, 10-year-old Timo nearly went into a coma. He suffers from juvenile diabetes, the causes of which are in part hereditary. This fate could well befall his sister Tamara, too, though she doesn't have the disease yet. Timo has to measure his blood sugar levels before every meal. Because he has diabetes, his body isn't capable of producing enough insulin to regulate the metabolism of the sugar. Timo tells us that his blood sugar level is 233, and that's pretty high. So he has to inject a larger dose of insulin. Otherwise, after he eats, his blood sugar levels will become dangerously elevated. 5 or 6 times a day, he has to inject insulin into his abdomen, according to a strict schedule. Diabetes is a burden for Timo's family, too.
Your child has a disease and you know it won't go away. Diabetes isn't the kind of illness where you say, we'll go to the hospital, take some pills, and then it's over with. It's a lifelong condition. All you can do is get a handle on it, and that can wear you down.
The family is taking part in a unique study in an effort to prevent Timo's sister from getting the disease. Researchers at this university clinic in Munich are trying to find ways to inhibit diabetes early on. The first thing they do is analyze the siblings' genes. The results are conclusive. Till, the youngest child, won't get diabetes. But Tamara is shown to have the same gene as Timo. That gives her a 50-50 chance of becoming a diabetic. A daily dose of insulin powder, taken in something like yogurt, might keep Tamara from getting the disease. It's a preventive method now being tested on children at risk who have yet to show symptoms of diabetes.
You can think of it as a vaccination that's meant to stimulate the immune system. Here we're trying to build up the protective T-cell count, which is much too low in diabetics.
Tamara is still free of diabetes symptoms. If she and the other children in the study remain healthy, it will be a milestone in the war against diabetes and provide a cost-effective treatment model for the world.
Professor Ganten, in Mali, in West Africa, a child diagnosed with diabetes can expect to live maybe a year, whereas here in Germany, such a child would receive treatment and be able to live a more or less normal life. What can we do to eliminate this kind of injustice?
We have to build up a health system in these countries. They should not be dependent on what we are exporting. They should be able to create their own possibilities to treat patients, have research capacities, and be self-sufficient in what they're doing. That's the most important goal.
Is the medical research that's being carried out in Western countries even useful for the people in developing countries?
Well, medical research is driven by curiosity and by needs, as everywhere in all areas of research, of course. But the needs are different, of course, in these countries. And we should not think about just, say, genomics and, so-called high-tech modern research. Prevention in our country and in the other countries is more important, and not enough research is done in this area.
What can a forum like the World Health Summit achieve?
Well, the World Health Summit has to bring together all those interested in health. They are diverse, politics, economy, industry, civil society, NGOs. They all have their important part, but they're not talking enough together, and they don't develop common goals. They sometimes develop separate goals, sometimes even antagonistic goals. So this has to be brought together in a forum and develop our own strategy, which is a common worldwide strategy.
Do you think that one day we will live in a world where everyone has access to the proper medical care, no matter how rich or poor they are?
Well, you can never do enough for health. That's the most important good for everybody, and this will be an eternal task probably, but we can achieve more than we do now because research is going on. Our possibilities are more than what we bring to the people. So I think we can have progress, but we will never have a world where everybody is happy with everything.
Just briefly, if you were king of the world, what would you do?
I'm happy I'm not king of the world, but my wish has been fulfilled by having the World Health Summit, bringing all these people together, defining common goals, and if this is even more successful as at this meeting, then I will be pretty happy already.
Professor Ganten, we're very happy that you were able to join us here today. Thank you.